interviews tend to go out in waves, and programs are looking to fill their slots quickly. So it's important that you're keeping an eye on your email as well as your spam folder, making sure that you're responding to those invites, because programs want to fill those spots, are just as eager to do so as you are to receive those invites.
You can think almost strategically about your top choice programs. So if you have a program that you absolutely know is one that you really, really want to be considered highly for, time out when you're accepting their interview. If they give you a range of dates, you might want to either try to go early in the interview season or late in the interview season, and sort of avoid that kind of middle of the pack mentality where a lot of interviewers and program directors can kind of get you lost in the shuffle a little bit.
Once you receive that interview invite, whether you get it by email, by phone, be ready. Be ready to maybe interview early, maybe interview late. Be ready to accept what they offer. If you have a scheduling conflict, be ready to be flexible with it, but also don't feel like they have to work around your schedule, because there's probably 800 other students that are looking for that same spot. Be ready also, if something happens in the meantime, to be in contact with that program to let them know. If you have a scheduling conflict and an emergency comes up, or there's a power outage in your building and you have to adjust, have a contact ready, keep a spreadsheet of everything you need for that interview, and be ready. And practice, practice, practice.
You know, one of the, I think, mistakes students make is they get obsessed with Reddit and see when other people post for their specialty that they got an invite, but you don't know their circumstances, right? They could have done an audition there and they're just sending out interview invites to students that have done auditions. They haven't really done a deep dive. Maybe they're working their way through cutoff scores. Maybe they're at the beginning of the alphabet and your last name begins with a Z. So don't get over anxious and worry about those interview invites. They're going to come through the month of October, maybe the early November. So remember, it's a marathon, and not to get overwhelmed just in the beginning. We are just beginning with interview invites right now.
I think, first off, there's a lot of variation by specialty. There's general trends where there's some specialties that tend to send out their interview invites earlier. There's some that send them later. I think there's also variation based on the size of the program itself, irrelevant to specialty. The larger the program, the more spots they have to fill and the more interview dates they're likely going to have. So their dates may span a longer time period, and so those invites could go out earlier. I think there's so much variation for a lot of different factors. We're also seeing this year that some specialties have agreed upon a uniform interview release date. So that's also a factor in the mix.
It comes in waves. So as people cancel, they fill those slots. As people interview, and maybe they end up interviewing more people. So don't ever count yourself out, because you don't know when it's going to happen. Don't say it's November, I'm not going to get any more invites, because you probably will. And that's the time to start looking at networking into programs to see if you can fill a slot that somebody's canceled. Letting those programs know, those program coordinators, don't call the program director, those program coordinators need to fill those slots. And as they cancel, let them know you're flexible. Let them know at a minute's notice you'd be happy to come.
Just understand that every program is operating on a different schedule. And as students maybe later in the interview season start canceling interviews, if they have already completed as many as they feel like they need, there might be more rounds of interview offers going out in November, December, maybe even January.
I think you should respond as soon as you can, when it's appropriate. If you're on rounds, then, if talking with a patient, don't pull out your phone and respond then. But, when you step outside of the room and you have a minute to check your phone, definitely you want to keep updated and respond in a timely manner, but don't let it interfere with your rotation and what you are doing during that month.
Respond as soon as possible, if possible, but in any scenario, try and respond within 24 hours. That way you can have a better chance of getting your preferred interview dates. Some programs are notorious for filling up within minutes, if not hours, of interview offers going out, but a lot of programs, they will send out their interview offers based on the number of spots that they have available. And so there should be some flexibility to scheduling it based around what you can manage.
utilize the expertise and experience of the advisors at your COM. They can help guide you through this process. They can let you know when it's time to start working or not. But more specifically, they can help you assess your overall competitiveness and your traction with invites. So I would say it's a very individual situation, but trust those advisors at your school and seek their guidance when you're unsure.
If it's been longer than you expect and you haven't received any interview offers, it never hurts to check ERAS and make sure that everything was submitted appropriately, that you're not missing any of the important required documents, that you sent the applications to the right places. And because if you're applying to programs that are within your kind of anticipated matchability based on your statistics and your scores, within a week or two, you might expect to be getting interviews. And if it's been longer than that, then it's always good to check and make sure you didn't forget anything important.
Some people tell us that it's going to be like a 5-minute window. We'll get an email, we'll get a phone call, and we have like 5 minutes. What if I'm in the middle of interviewing a patient? What do I do if I hear my phone go off? And I said, well, you finish interviewing that patient because you're in medicine. That's what you do. And one thing that they need to remember is if you have a program who offers you 5 minutes to respond, and they know you're on clinical rotations as fourth-year medical student, and that program expects you to get up and leave the patient's bedside, is that really where you want to train? Is that the program you want to spend the next 3 to 4 years at?
The patient is what comes first, and that is their time, that is their appointment time, that is their medical care. And as important as residency interviews are for your career, the patient in front of you trumps that. There's plenty of time usually between patients to check your phone for interview offers. So when your attending is writing notes or in between patient rooms on rounds, and attendings, especially during interview season, are pretty accommodating of that. If you have someone who, if you're rotating with someone who's maybe a little bit older, they're not quite really, in this sort of cycle of knowing when ERAS is, when ERAS comes up and when students are applying and getting interview offers, it never hurts to give your attending a heads up. Say, I just submitted my residency applications. I'm sorry if I happen to pull out my phone, but I don't want to miss a possible interview offer. That 19 times out of 20, your attending is going to be 100% understanding of that fact. And if you need to ask to take 15 to 20 minutes to step away so that you can specifically schedule a highly desired interview, that's definitely appropriate as well. Just make sure that you're creating an appropriate balance between taking time for scheduling your interviews and continuing to fulfill your duties as a medical student on that rotation.
So if you look at the NRMP match data, you need about 10 to 12 interviews in order to rank, in order to match in most specialties. And so, 10 to 12 is a good number to start with. Remember that virtual interviewing can be a little bit tricky for some individuals. So if you're not comfortable, then your first couple of interviews might be like to less programs that you really aren't as desirable for you. So you can practice those interview skills and get up to par with virtual interviewing. And so you might, need up to 15 interviews. But, last season I had students that got 30 interviews. And I definitely think there's a point of no returns, because if you're not putting in the time, looking up the program, knowing the strengths of the program, coming up with appropriate questions, then it's going to be a generic interview for you, and it's going to be a generic interview for the program. And that's not going to be memorable for either of you. So, if you're not going to invest that time, then it's really not worth doing the interview.
I found when I was interviewing for my residency programs back when we were doing all in-person interviews, it was about that 10 to 12 range where my brain started to lose a lot of details. Even though I was traveling to each of these programs in person, they were still kind of running together and I was having a hard time keeping them straight. So I can imagine how it's even more confusing in the virtual interviewing cycle. So make sure that you take good notes, because you're going to have very limited opportunities for making sure that you keep these programs very specifically individualized so that you know which ones you want to rank. Beyond 20 seems like it might be more than most people can keep straight. And unless you have a particular reason, like a couples match or trying for something highly competitive, beyond 30 would probably be a completely diminished returns on the time invested and the time away from your rotations. For virtual interviewing, the number one important things for you as a candidate and for you as someone who's trying to rank is to make sure that you both get a good impression of the program and you leave a good impression for the program. So doing your research ahead of time, knowing what the program strengths are, knowing about the areas that you may want to ask questions about, writing down those questions before the interview so that you have them ready, and then knowing your application inside and out, because I can assure you that your interviewers will be pulling details from your CV, from your personal statement, from all throughout your entire academic history, and be prepared to answer questions related to anything that you put on your application. And also be sure to know how to highlight yourself as like a unique individual so that you yourself can stand out, especially in the virtual realm.
Succeeding at virtual interviews begins with practicing. People don't understand they can't practice enough. You need to be comfortable. You also need to utilize the resources that your school provides you. Look at the things that your school's kind of telling you to do, the things that AACOM has published, their interview resources. Also, remembering that you need to be sure and convey to the person you're interviewing with if you want to take notes, if you're going to be reading notes, just so when you're doing this, you need to be sure that they know what you're doing, that you're not paying attention, but you're actually paying attention and keeping some notes. All those things that you need to be remembering in a real interview, in a live interview, is almost doubly important in a virtual interview. So being on time, making sure you've got a good internet connection, having a backup. Always prepare for the worst case scenario, and that way you're bound to do pretty good with them.
Remember, even if you have to put a sticky note by your camera that says, look here, you want to try to look at your camera and not at the person at the bottom of the screen where their picture is, because you want to kind of directly look at them when you're talking. And then another pitfall is not remembering things. So if you have to, put things on your computer screen so you look like you're looking at them, but you're actually reading some notes that you made for yourself for the interview. So those are a few quick tips that you can help you interview better virtually.
If you have risk factors in your application, if you've been on leave of absence, if you failed a class, if you failed one of your COMLEX exams or a USMLE, be sure that's not the center of your application. One thing that I've really seen in the past 2 years with virtual applications and with all the virtualness is we almost want to treat virtual interviews kind of like doing something on Instagram or Facebook, and we want to overshare. So if you had a leave of absence for a medical reason and they ask you, what was your leave of absence? Be ready to, and have it practiced, have it written out. Be ready to say what happened, how it affected you, how you fixed it, and how it could affect you as a resident. This is a job interview.
When I was interviewing in person for programs in cities that I'd never been to before, one of my first resources that I would look to was personal connections. Friends, family, friends of family in the area, ask them about what it's like living there, ask about what kind of hobbies that they engage in, because a huge part of success in any residency, no matter where you go, no matter what specialty you're in, is going to be your personal support system. And while you may be able to find that in your residency, it's also really great to be able to have that outside of your residency as well. Other than that, I always recommend talking to current residents about what they like to do in their free time, how they enjoy their city, how they enjoy the local area, what things there are to do. Those are some of the best ways to really get to know what life is going to be like in a place that you've never lived in before.
Residents love to talk about their programs. They love to share with you about their programs. So attending any and all virtual offerings that they have, meet and greets, any kind of information session. Also working with your graduates from your school. They went to medical school where you did. So chances are they may be interested in that program for the same reasons you are. So finding out and connecting with graduates that may be in that program, or may have even, if they tell you they interviewed at that program. So being real careful to vet it with people that you actually know in the program. I've seen some people make some really bad mistakes the last few years by looking at Reddit spreadsheets about what cities were toxic or what programs were toxic, when maybe your school had 3 graduates in that program and they loved it. Talk to those graduates.
Good luck through the process. We know it's stressful, but reach out to your classmates or the advisors at your school. They can kind of help guide you through the process and lessen the anxiety that you feel, because every resident right now is going through the same anxiety. You're not the only one.
This is about finding a program that is going to be excited to take you, but also finding a program where you are going to thrive, someplace where you can learn and really be the best doctor that you can be. So take this opportunity to really find a good fit and look at the programs from a perspective of where do you want to spend the next X number of years.
We can't wait to see the places you go. This is an exciting thing. It's exciting for us. We're kind of like a coach at this point. We can't wait to see where you go and what you do. So good luck.